Good afternoon. I'm Jim McDeavitt. Good to see you. I'm coming to you from my office, my undisclosed location for the COVID environment. I will tell you one of the things I miss about the pre-COVID world is I used to spend half my life running up and down Fannin Street, and I got 12,000 steps a day easily just going back from here to O'Quinn. And now I sit in this little room all day, every day, doing Zoom calls, one right after the other. And I probably go about 3,000 steps a day. So I'm coming to you through this media for two reasons. First of all, this is the most exercise that I've gotten for the past 3 months. And secondly, because I've got some important things, simple things, but important things I want to communicate. I will send them out in writing. But we send out so much information in writing, I feel like sometimes it gets lost. And there are a couple things I want to be really clear about today. First of all, who am I talking to? I write a lot of emails. I've written a ton of emails over the past several weeks, months now. And I often start by saying, faculty, staff, researchers, clonicians, educators, students, residents, fellows, allied health providers. For the purpose of this message, I'm talking to everybody. If you're a part of the Baylor community, this pertains to you, and it is the same message for everyone. Past week, in terms of COVID-19 in the community, if you follow the stats on the Baylor website or the TMC website, it has not been the best week in terms of the virus, in that we are seeing growth in the hospital. We are seeing increased hospital admissions. We are seeing a higher percentage of beds being taken up in our ICUs. And it's not a crisis point yet, but were this to continue for the next couple of weeks, our hospitals will get to a point where they will have to start thinking about doing some things to create capacity to have enough ICU beds for patients, for example. I will say this is exactly what I expected to see when we relaxed social distancing and we started getting out in the community, and particularly as I started going out and seeing people in restaurants that seemed to think it was 1999 again, and COVID wasn't a real thing. Obviously, some people in our community have taken social distancing really seriously, and some people have not. So I think it is expected that we're going to see a growth in the virus. That is expected. It's going to continue. And we're going to be dealing with this for weeks, if not months. And we, Baylor, have to learn how to function in this environment where we will be coexisting with the virus for, unfortunately, an extended period of time. And we can do this, and we've proven over the past couple of months we can do it, and I think we've gotten much better at it. What I want to focus on today is, in that environment, given that we are going to be living with the virus in our community, how do we keep the Baylor environment safe? How do we keep all of you safe? How do we keep that Baylor community as safe as possible? But there are really three components to how we're working to keep the Baylor community safe, and I'll outline those in just a second. The first is, and these are all important, is screening. This is second nature to most of you that aren't working from home by now. You know, when you come into a Baylor building, you're filling out the app, you're attesting to your symptoms, somebody is monitoring your temperature. We are not letting people who have symptoms or who have temperatures get into our building. Critically important. Thank you, thank everyone for your cooperation and your embracing the importance of that. I think we've had really, really good compliance. A secondary message is, if you have symptoms, don't come to work. We sort of have a culture where we kind of tough through things and come to work. Well, that has to change. We have to have a zero tolerance for people showing up with cough, with fever, with symptoms consistent with COVID-19. If you have a symptom, you need to stay home, period. And I think that's really important. That's our best single line of defense to keep our ecosystem relatively free of the virus. So that's one important, simple tool, but a really important tool. Second important tool is our testing strategy. And now that we are beginning to reopen and re-expand and increase our numbers, we have, I think, what is a thoughtfully derived approach to how we are testing our folks. We are using diagnostic testing, and it's a Baylor diagnostic test. And there are three groups that are being tested. First, and this is one of my main messages today, symptomatic I want to be really clear about this. If you have symptoms of COVID-19 and you are part of our Baylor community, you are going to be tested, period. That is our procedure. I think there's been some confusion around that. I think in OHP in our call center, there was perhaps some inconsistency in advice being given as this has evolved over time. Everybody's been retrained, re-educated, everybody's clear on the policy. So I'll say it again, if you have symptoms and you're part of the Baylor community, you will get diagnostically tested. So that's our one big group of testing. Our second group is surveillance testing. I'm not going to spell out surveillance because I will invariably misspell it as I'm writing on the recording. But surveillance testing is geared towards people that we know are in high exposure environments. For example, the ENT clinic putting scopes down tracheas all day long, the pulmonology clinic, the cardiologists that are doing stress testing and having people forcefully expire gases during the course of their evaluation. And we recently added ophthalmology to that list because of the nature of what they're doing. We are doing surveillance testing of those groups on a regular basis. That has started recently. I think we've done 15 tests so far. It's happening on a daily basis now. We've had no positives so far. But we are doing regular surveillance testing and will continue to surveil. And lastly, we're doing sentinel testing. So randomly within the entire Baylor community, a number of tests are being done, will be done starting on Monday. To do spot checks around to see if we've got the virus in place. So symptomatic testing, surveillance testing, sentinel testing, that is our testing strategy. And if you have symptoms, you should expect that you are going to get tested. So that's our second weapon. Our third weapon is our internal capacity to do contact tracing. And working with Elaine Szymanski, we have trained now 2 full-time contact tracers. We call them COVID detectives. It's a much more glamorous term than contact tracer, but they are available. And if we get someone who tests positive for COVID-19, the role of our internal contact tracer is to have a conversation with the person who tests positive, to talk to them over a period of time about all their exposures within the Baylor ecosystem, and to discern which of those contacts are close contacts and which were not close contacts. And there's a little bit of an art to that determination. I think CDC defines a close contact as within 6 feet for 15 minutes or more without any protective equipment. So that's sort of the standard. It's sort of a loose standard. And if you are a close contact, I'm infected, and my colleague was a close contact, our contact tracers then would develop an individual exposure management plan for that secondary exposed individual at Baylor, which probably involves heightened surveillance, monitoring of symptoms, could potentially involve additional testing. So that is our threefold plan. Scrupulous attention to screening, a rational testing strategy, and internal contact tracing capacity. Lots more going on behind the scenes, and if you have any questions, or if you feel like something isn't working, if you see something, say something. If you feel like something is not going as advertised, then you should feel free to contact me directly. You can reach me at svpclinical at bcm.edu. And I will look into your concerns and get back to you. I want to thank everybody for your support as we learn to function together with COVID-19 and continue to serve all the important work of our 3 missions. So thank you, and everybody stay healthy.